The Centers for Disease Control says the prevalence of autism in America has reached a level where it's occurring in 1 in every 110 births. And for boys, it is 1 in every 70. Right now, there are 1.5 million Americans living with autism, so it's easy to see why this is such a big talker today. I want to go a little bit more in depth on this, not only this topic, but what's the bigger picture of looking at medical studies themselves when it seems a new one is coming out just about every week. Gary Schweitzer is joining us now. He has specialized in healthcare journalism for more than 30 years and is the publisher of healthnewsreview.org. So, Gary, thanks for being here. We want to start with this news that the autism study that we've all been hearing about for a very long time wasn't just wrong, but the information was, in fact, made up. How did this happen?
Yeah, well, I think one of the good news angles to this very unfortunate story is the difference that even one journalist can make.
Right.
Because, after all, it was this journalist, Brian Deer, who's largely responsible for uncovering and dismantling this whole sorry picture. Journals are not perfect. And I think that many journalists, many in the general public, have a misimpression that when something is published in a prestigious journal, it's as if it has been written in stone tablets and handed to Moses to bring down from the mountaintop.
That's right. And it's interesting. I think that also translates directly to the medical community. When you are the patient and you're speaking with your physician, a lot of times, because we don't have the information or the training, we have to take that information and believe it, whether we're suspect or not. So I think this is a really, really good lesson for everybody.
Well, and let's take this head on. I think that honest, caring physician researchers and medical journal publishers would tell you that they are not perfect, that the peer review system that is behind the review of studies like this or all the others that appear in journals, that peer review system itself is flawed.
Well, help our viewers at home, because here's what's happening. I mean, we tend to come into work and we put together these newscasts, and we are very meticulous about it. We have a lot of discussion about what goes in these newscasts. And when it comes to some of these health studies, we put them out there. The folks at home are watching and they say, oh my gosh, now I can't have more than 1 glass of red wine. Or wait a minute, now tomorrow it says I do need to have 1 glass of red wine a day because it's very good for anticoagulation. And this is just one example. I'm saying, what do you do when you're the consumer and you're sitting at home and all of this is coming at you?
Well, you take much of it with a grain of salt. If you're going to be really interested in these stories, it seems that we simply must all become smarter in learning how to evaluate the evidence. So with the Wakefield study, when you hear of a study in a few children, this should raise huge red flags. And unfortunately, Heidi, and as you probably know, I came from a TV news background. We spend too much time in TV news with these briefs of 15 or 30 seconds that try to explain journal studies, and they simply cannot do a good job. So my advice to journalists and to the general public is, if you can't be more thorough, if you can't stop to evaluate the evidence, you probably would be better off not reporting on studies from journals at all. You may be doing, although you don't intend to, you may do more harm than good.
I think there's a lot of confusion that tends to be out there. So some great information tonight, and we sure do appreciate you being with us. Gary Schweitzer, thanks so much.
Thanks for your interest.